Hi, thanks for watching the video today. This short video I'm going to be talking about fat transfer to the face as well as the hands. These are typically used as an anti-aging procedure. As we age, we lose volume in the face as well as in the hands. A lot of women forget to take care of the hands. They always focus on the face. They want their face to look as young as possible, and that's great, but then when people see your hands and you've lost all the fat in the back of the hands, you can see your tendons and your blood vessels. That just gives away your age immediately. So don't forget about the hands. Now, the fat transfer to the face, it's something that you want to focus on to add volume, particularly up under the eyes. You start to get these bags, and lack of volume under the eyes, it makes this bone a little bit more prominent, which gives those dark bags. So adding volume, it'll soften up that edge, add more volume to the cheeks so you have more volume up here. Typically people tend to, with age and gravity, everything tends to droop down, and they get into the fat droops into the jowls area here. It gives a typical look of aging. It also tends to square off their face. So with the fat transfer, we can restore that volume up in the top. Through liposuction, we could potentially take volume from the jowls if that is an issue for you. We can also restore volume in the nasolabial fold. Some people like volume in their temporal area. We can put it pretty much anywhere that you want. We can also make bigger lips. Some people like to they have to get lines on the side of their mouth or under their chin here. The addition of volume into the area will essentially stretch the skin and reduce wrinkles in the area. It also, a byproduct of the fat transfer, there are stem cells within the fat, and the stem cells are believed to help replenish the nutrients in the skin, and it tends to give people this healthy glow afterwards. And because the skin is stretched, it becomes more taut and has a shinier, healthier glow to it, which is quite appealing, and it's something that most people wouldn't expect, but it's a great result. People have been very happy with fat transfer to the face, and the nice thing about it is, in contrary to temporary fillers like Juvaderm and Restylane, the fat transfer is thought to be permanent. Now, with that said, nothing in life is permanent, right? You're going to continue to age, and as we know, with the aging process and gravity, things tend to droop. So in time, the normal aging process will continue. The hope is that you'll get good results for anywhere from 5 to 10 years after the procedure, and you may want to consider doing additional treatments after that. Maybe not. Regarding the fat transfer to the hand, simple process. We're going to make tiny little puncture holes in between the knuckles. We'll numb up the area and inject fat all throughout the back of the hand, and you're left with kind of a puffier look to the hand. When things shrink down, you'll be left with less visible tendons and blood vessels on the hand, and that gives you, and again, you'll get more of this shiny, taut look to the skin, which just gives it a healthy glow, and is very good for anti-aging. With the fat transfer, just as with the fat transfer to the breast and the butt, we don't want to put pressure on the area. This is fairly easy for the face. Most people don't put pressure on their face, but you want to avoid putting pressure as much as possible, wearing hats or things of that nature that may put pressure on the area. The back of the hands. Now, with the hands, it's not necessarily the pressure, but you want to limit the use. So if you're using your hands a lot, it could potentially put stress on the fat, and you get less fat survival and less results. So if you could limit the use for the first week or two, that would be very beneficial in the results. I hope this answers many of your questions about fat transfer to the face and hand, and if you have any other further questions, feel free to ask us.